Good morning and welcome. For those of you who don't know me, my name's Scott Wilson. I'm a partner in the Duncan Cotterill Specialist Employment and Health and Safety team, and I'm presenting today's webinar together with Sarah Townsend, who's also one of my fellow partners in our specialist team. I don't think because of the limitations of MS Teams you can see Sarah, but you'll get to do so later in the webinar. Look, today we're dealing with health and safety obligations, and principally as we transition from level 4 to level 3. The last 48 hours has certainly been quite a frenzy as people have rushed to get their takeaways and their coffees and enjoy some of the comforts of their previous existence. And judging by this morning's press, if any of you have read that, there's concern at a public health level as to whether that in and of itself is going to give rise to clusters and create problems down the line. And I guess time will tell. And the whole situation the last 5 weeks I've found, and others have commented similarly, that this whole situation has been so fluid. But before we get into it, there's a couple of housekeeping matters that I'd like to deal with. The first one is that this webinar is being recorded, and a link will be available if you want to watch it or pass it on later in the day. And secondly, you probably can see, it's not something I can see on my screen, but to the right, I think it is, there's a Q&A panel. And if you type in questions, we'll endeavour to get to those. There'll be hopefully time for questions at the end of this session. So open your questions and deal with them at the end after Sarah has finished her session. So if we can bring up the first slide, please. Right, so what are we going to deal with? First up, we'll start with a very brief recap and background of where we've been and where we're going. Then we'll look at the overlapping duties, how the duties, health and safety duties under the that arise in a COVID-19 situation overlap with existing obligations, because there is an overlap. Then we'll look at planning and preparation for work, and aligned to that is managing risk and exposure to COVID-19. And the final matter that we're going to deal with is obligations in and around working from home, and that's something that's often overlooked, but there are certainly duties that fall on businesses that have workers working from home. Next slide, please. So in terms of a recap, well, I think we all heard what was almost a collective sigh of relief when we moved from level 4 to level 3 just over 48 hours ago. What the government and the Prime Minister in particular has been at pains to stress that level 3 is still a high alert level. Now, under the previous level 4, only businesses that met the government definition of essential service could operate. Now we've got media reports refer to an additional 400,000 or so people back to work this week. Now, at level 3, people who are able to work from home must do so. And that's something that the Prime Minister and others have emphasised on a number of occasions over the course of the last week. For those who can't work from home and need to return to site or need to return to their businesses, they need to carry out their work practices safely, and work needs to be done safe with health and safety and physical distancing measures in place. It's not simply a case of returning back to work, as some people seem to think. There are what are reasonably stringent requirements in place to ensure that work is carried out safely, to ensure that the government's lockdown objectives are maintained and achieved. Under level 3, those businesses that are or will be operating have to have appropriate health and safety measures in place. That's implicit from what I've just said. There needs to be a documented plan. We'll come back to and deal with that in more detail lately. It has to cover numerous things, including physical distancing, and there are some things that are mandated for the plan. What I have heard over the past few days, although the position seemed to change slightly this morning, is that there was a suggestion that WorkSafe, MPI and the police would be carrying out spot checks to make sure that businesses did have those systems in place. Whether that is in a virtual way, it seems to be the case. In terms of the overlapping, just moving to the next slide, overlapping duties, COVID-19 is a workplace hazard. It's also a notifiable disease. Being a hazard, it has to be managed like any other health and safety risk or hazard. The primary health and safety duties continue to apply in this situation. Businesses have a duty to ensure, so far as is practicable, it's a bit of a mouthful, that workers are not exposed to the virus. And one thing to bear in mind is that if you don't manage a risk appropriately, you may find yourself in a situation where workers refusing to carry out the work, and there is a duty or a right, both at common law and under the health and safety legislation, for workers to refuse to carry out work that they reasonably view as being dangerous. And there was a situation early in the lockdown period where some factory staff actually looked to exercise that right. So managing risk, what does that require? It requires an identification or an assessment of the risks involved in operating under the new alert level and implementing controls and safe working practices. I've touched upon it already. To operate under alert level 3, businesses have to have what's deemed a written or documented Code 19 safety plan in place to protect staff and others. And that's actually a separate document from, and it's additional to the health and safety plans that businesses should already have in place. So if we have a next slide, please. We've talked about risk management. The key controls to minimising the spread of COVID-19 at work will be familiar to most of us, and these have been decided upon by public health authorities, and they're listed there. So it's supporting people with flu-like symptoms to self-isolate, ensuring physical distancing, good hygiene, making sure that people are washing their hands regularly, and there are sneezing protocols and the like. They're not coming to work when they're sick. There's regular cleaning and disinfecting of surfaces, and there's an obligation to keep written records or a register to facilitate contact tracing. That might be an electronic register, and there are those available in the marketplace, or it can be a paper-based system. What is or may be overlooked with the focus on COVID-19 is, but what you do need to have regard to is identifying and assessing what other risks may emerge in your operation from any change in operating procedures and protocols as a result of implementing controls to deal with COVID-19 and managing those. Factors you may want to consider are how you interact with other businesses, bearing in mind that businesses need to be contactless. Do you have vulnerable workers? What will be the situation in relation to them? The government's position is that they may choose to work, or they may choose to stay at home. And if they do, there's the essential workers leave scheme has been tweaked so that it now applies to those working under level 3, and there is a qualification criteria. the criteria is the same as it was for essential workers. And if there's any questions in and around that, I won't deal with it now, but we can deal with it later by way of questions and answers. Change the slide, please. Physical distancing is a key control measure. We're all past masters of that now. Just from out and about now, regular walks, we're keeping our 2 metre distancing. And what sort of separation controls you have in place will ultimately depend on the nature of your business and what you decide upon in consultation with your staff. Measures might include isolating workers whose task can be done alone, limiting or eliminating physical interaction between workers and others, the use of barriers, we've seen that in supermarkets, limiting contact time, worker safe as suggested where possible to under 15 minutes, reducing contact between different business units, the use of split shifts, meal times and breaks, entries and exits, and even suggestion that there are limitations in and around the use of bathrooms and the like. It's something that will need to be discussed and consulted with staff in relation to, and it's something we'll come back to. And as I said, it'll be specific to business, so what you decide upon won't necessarily suit. There's no blanket system that can be applied across the board. WorkSafe's position in respect of PPE is that generally, and this is all they can mandate, that there won't be additional requirements for PPE beyond that which would be required routinely in the operation of your particular businesses. But there may be, because of the nature of the workers in place, the work or the changes, that may be something that needs to be looked at. And it's a fluid situation, and it needs to be assessed continually over the next 2 weeks, hopefully, until we move to a lower level. Information sharing, keeping employees informed and sharing information is an important part of meeting health and safety obligations, as it is generally. It's part of a PCBU's and businesses' duty to engage with workers. That's a statutory obligation. So all organisations will be required to ensure that workers know how and are able to keep themselves safe from the exposure to COVID-19. And it has been emphasised, and it's correct, that notwithstanding the wealth of information that is promulgated on a daily basis, and possibly because of it, you shouldn't assume that your workers understand what is required, or understand fully what is required of them to minimise their exposure. So how can that be achieved? This can be achieved by ensuring workers have access, among other things, to right information about keeping themselves safe and well, and that there's regular discussions about this at team meetings, toolbox meetings, depending on what you operate at home. WorkSafe has suggested that businesses consider providing information sheets and signage to remind workers of physical distancing, of the hygiene protocols, and the main COVID-19 symptoms. And you would have seen those at some of the supermarkets and the like that have operated on the level 4. And the final PowerPoint under that heading is the requirement to, and I've touched upon this in passing, share and consult in respect of the COVID-19 plan with workers and others before any work commences, and that's something that Sarah will deal with in a little bit more detail shortly. New slide, please. So gathering information on wellness and safety is also important, and it's critical that those who are sick don't come to work. Businesses operating under level 3 will be required to check in regularly with their staff to ensure their well-being, and have systems, have a plan in place to ensure that. And what that plan might look like will be business specific. It might include symptom checks. It might include, some businesses have gone as far as actually measuring temperature on a daily basis. The system and plan will need follow-up, so that those workers who are exhibiting signs of unwellness only return when they have recovered. There seems to be a little bit of variance as between the timeframes that you should wait before people are judged as symptom-free, work safe, and their publications refer to a 24-hour period. The Director General of Health, Ashley Bloomfield, refers to a 48-hour period, and the longer period would be more prudent in my view. WorkSafe have also suggested that the plan encompass other facets, such as the possibility of a flexible leave arrangements for staff, so that they're not encouraged to come in where they are exhibiting signs of unwellness. That's been a factor with the historically, just with the limited number of sick days available under the legislation, and it will be dependent on the ability to pay. How businesses approach that, this exercise will very much depend on size and scale. Smaller businesses, it's probably a case of just having a regular chat with workers. Larger businesses will need a more systematic system approach in place. New slide, and that's Sarah's picking that up.
Thank you, Scott. So following on from Scott's presentation, I'm going to touch upon what to do where there is exposure to COVID-19 in your workplace. So for example, somebody has tested positive or has gone home with symptoms consistent with COVID. I'm going to talk a little bit about what the COVID-19 safety plan should look like and what guidance is available to you from WorkSafe. And finally, I'm going to speak about the steps that you need to consider taking for where you have employees continuing to work from home through the alert levels. And then we'll take any questions that that anybody may have, and Scott and I will deal with those at the end as they come up. The information that we're providing is necessarily at a relatively high level, and each different business and each different industry will need to manage things slightly differently. So first of all, managing exposure to COVID-19, this is what we're all trying to avoid, but it is inevitable that in some workplaces at some stage there will be an actual or suspected case of COVID-19, and these are the steps that as a business you should take to ensure that the situation is managed properly. So first of all, as has been repeatedly made clear, any workers who are unwell should not be at work. So if somebody becomes unwell at work with any of the symptoms of COVID-19, and just as a reminder of what they are, and they are being tweaked a little as time goes on, but include a high temperature, any shortness of breath, a sore throat, cough, now includes sneezing and a runny nose, quite commonplace symptoms of a cold, of course, and loss of a sense of smell. So if anybody in the workplace experiences any of those symptoms, they should immediately go home, and Healthline should be contacted. You need to speak to the employee about who is going to contact Healthline, the employee should contact their GP. You then need to take appropriate steps to manage the risk within your workplace and ensure that if indeed this is a COVID-19 situation, that the risk of spread is eliminated or minimized. The guidance on the various websites available is not hugely consistent. Your WorkSafe says you're not required to close down your workplace, and that seems sensible, but of course it will depend on the workplace, the nature of your business. You should take appropriate steps to make sure that people are not accessing the area where that unwell employee worked, and it might also be sensible to send people with whom they've had close contact while they've been at work home as well. You need to, of course, clean and sanitize the area, all surfaces and equipment that have been used, and you need to make sure as part of your safety plan for returning to work that you do have all that cleaning and sanitizing available to you so that you can use it. You need to then gather records as to the workers' close contacts and also understand what equipment has been used. And this is where the register that Scott mentioned in his part of the presentation comes in. As part of a COVID-19 safety plan, it is a requirement for businesses to keep a register of everybody coming in and out of the workplace. That includes not just workers, but also visitors, and the length of their visit and the reason for their visit. Businesses also need to be asking all of their workers who are on site to keep a list of their close contacts, people who they are coming into contact with as part of their work. If they're only going to be on one site during a day, that's easier to manage, but if workers are moving across different sites, that may be more difficult. And in fact, you might need to reflect on whether that's appropriate under alert level 3 to be moving around different work sites. Again, if it can be avoided, it should be. Now, the guidance on what the records should include, I said the name, contact information of everybody who has been at the site and the reason for their visit. That is what WorkSafe is suggesting be recorded. And WorkSafe is also asking that those registers be kept for at least 2 months. So if you're thinking about your record keeping requirement, remember to keep those registers for 2 months at least. And again, you do need to consistently remind your workers to keep their own close contact record and to have that available to you in the event of a potential exposure to COVID-19 to enable contact tracing. After that, it's a question of waiting to be contacted by the public health authorities. So Healthline will contact you. You don't need to follow up with them, and they will provide information and guidance about further steps that may need to be taken. So those are the things to be aware of when managing a actual or suspected COVID-19 exposure in the workplace. Going to turn now to have a look at the COVID-19 safety plan that Scott mentioned during his presentation. As Scott mentioned, it's important all businesses who are operating back to work at level 3 must have a written COVID-19 safety plan. If you haven't got one in place, you should not be operating under level 3. It'll be too small on the slide, but I've got a picture of what WorkSafe has provided that's accessible from their worksite, and that's provided really as a guide or for assistance to businesses as to the types of things that they require the safety plan to include. I will summarize them on the next slide, but broadly they are all of the things that Scott talked about in his part of the presentation around what planning has taken place to manage risks, physical distancing, and so on. There is a great deal of industry-specific information out there, and I encourage you to look at the WorkSafe website for industry-specific guidance, and also liaise with your own industry groups who will also have been either lobbying MB or communicating with government agencies, or will have a good overview of the industry requirements for operating at level 3. Scott touched upon in his presentation the need to share the plan and communicate with workers and other businesses. And I'd like to spend a few minutes just really emphasizing that point. So it is not enough to simply go on the WorkSafe website, print off the plan, fill it out, and then put it on a notice board, for example, at work. There is an obligation, and there always is an obligation under the health and safety legislation and also under employment law, to involve your workers and your staff in the creation of this plan, and this is before any return to work. So it's important to get insight from workers about what their concerns are and what the risks are that they might be facing. They also, of course, have the best knowledge about how they're working day to day and what the practicalities might be of the measures that you're looking to put in place. The other reason why this is important is because there is likely to be quite a high level of anxiety amongst your workforce about returning to work, and potentially concern about, how am I going to be safe? How can I be confident that my employer is going to keep me safe at work and I'm not going to expose my home bubble to additional risk? And that level of anxiety will be particularly high for people who may have individuals within their home bubble who are vulnerable, for example. So the obligation is to create the plan in conjunction with your workers, and that includes talking to them about how you're going to manage the risks and the processes that you're going to be putting in place. So that can obviously be done remotely, because you need to share that information before everybody comes back to work. So that emphasizes even more the importance of having contact information for all of your staff. I think being in level 4 lockdown has brought the reality home to a number of businesses that we may not have all the contact details we need to get in touch with staff. We may only have a phone number, for example, no way of contacting people in writing or by email. So do make sure that you do have all that contact information. Now, for the WorkSafe, for this COVID-19 safety plan, there isn't any obligation to register your plan with WorkSafe, for example. WorkSafe are clear that the obligation to manage health and safety at work falls on the business and its workers. So it's not a requirement to register the plan, but you do need to have a plan because it demonstrates that you've given some thought about how you're going to manage your risk. So there's some more detailed guidance on the WorkSafe website, and I encourage you to go and have a look at that if you're interested in seeing what they're providing by way of template. But these bullet points on this slide here incorporate what is required to be included in your COVID-19 safety plan. So it should cover all of those bullet points, but it also should be clear on who is responsible for what, and also how often these things will be reviewed. So this safety plan is a living document. It's not something that you prepare the day before a return to work and set and forget. It's something that will need, as with all health and safety management and control measures, continuous review and improvement. And in the current environment that we're in, that might mean daily with your employees discussions about whether the measures that are in place are working well or whether they need tweaking. So the first point up there in terms of the planning and preparation, Scott touched upon this, but managing risks from restarting after lockdown. There may be, machinery that's been shut down for a long time, or other pieces of equipment that haven't been used for 4 or 5 weeks during lockdown. So ensuring that they are able to be restarted and operated safely. There's likely to be some cleaning that needs to be done of common work areas before everybody returns to work. Ensuring that you've got, again, Scott touched upon this in his slide, so this is just to summarise, providing information and instruction on workers on how to keep themselves safe, and importantly, what your expectations are as a business for them. So it's not sufficient for you to assume or rely on the fact that employees are watching the news or keeping up to date on the latest COVID information that's being published by the government, you do need to be specific about what it is that you need them to understand about your workplace and your safe operation. So the assessing that workers are well and safe to be at work. WorkSafe's recommendation is that that is done daily with workers. And so you need to consider, and again, so this is something that you need to be discussing with your workers about how best to manage that. So that might be easy if you've only got 4 or 5 staff. It might be a question of, calling them or having some system whereby they confirm that they are still in good health, that they are not displaying any symptoms of COVID-19, that nobody in their bubble has got COVID-19 or is displaying symptoms of COVID-19, for example. So have a plan in place. Scott mentioned in some workplaces that as workers' temperatures are being taken every day. So again, different things will work for different workplaces, but make sure you've got your plan, make sure you've got your plan tailored to your workplace. You've involved your workers in how you're going to do that, and assess that safety on a daily basis is the current information. Implementing controls and safe work practices, that's about managing risks, as Scott touched on in his part of the presentation. So again, to be clear, businesses that are able to work at level 3, it's only possible to work at level 3 where it's not possible for workers to work remotely, and also importantly where the risks of returning to work can be appropriately managed. So if you can't appropriately manage your health and safety risks because it's not possible to implement physical distancing or, for example, or the other safety measures, then you can't open under alert level 3. And there'll be some guidance from MB in terms of the types of business that can return. I've talked about managing exposure or suspected exposure to COVID-19. And again, reviewing whether the system or plan is working is really, really critical as part of this safety measure. I've spoken about consulting and liaising with your workers and your employees on a regular and daily basis. It's also important to remember the obligation to consult, cooperate and coordinate with other PCBUs who you may have dealings with. So that's other organisations that you're interacting with as part of your work. You need to be talking to those organisations and understanding what safety measures they have in place to ensure that they're not bringing risks into your workplace and you're not bringing risks into those. So the consultation and cooperation is not only with your employees, but also with other businesses. And finally, the safety plan needs to include an assessment of whether the risks associated with your business as usual work are impacted by your safety plan. As Scott mentioned right at the beginning, return to work under alert level 3 is very unlikely to mean an alert to business as usual, and you may need to think about either changing some aspects of the way that you work, and WorkSafe, for example, give by way of example work that may have needed 2 people to lift something that's particularly heavy. That now can't be done if you're complying with physical distancing requirements and measures. So you need to have a think about, can it be done another way? Do we need to change the way that we operate? Or are there some things that we're simply not going to be able to do under alert level 3, and we're going to need to wait until alert level 2? So it's not necessarily a return to BAU. Before I turn to the working from home requirements, I would emphasise that we've been talking today around what alert level 3 looks like and health and safety around alert level 3. Our expectation is that this will remain in place, or a lot of it will remain in place under alert level 2. It's likely that some rules will be relaxed, for example, the requirement to be completely contactless, and that some contact with clients and customers is likely to be permitted under alert level 2. So we're going to see, for example, the welcome return of hairdressers under alert level 2, but that will still need to be managed from a health and safety perspective. It won't be a case that all safety measures in relation to COVID can now be lifted and ignored. So what you're putting in place now will hold you in good stead for what you need to do under alert level 2 as well. So finally, working from home, which is what many of us, where we've been lucky enough to be able to continue to work from home under alert level 4, have been used to over the last 4 or 5 weeks. Again, under alert level 3, those who can work from home must work from home. Working from home comes with some responsibilities for businesses in and of itself, because we are now in home-based workplaces. We're still technically in a workplace, so there's an obligation to ensure, so far as reasonably practicable, that we are all safe at home. So there are some steps that businesses shouldn't forget about for their workers that are at home, but those steps need and should be proportionate to the risks that are being faced, and with an acknowledgement, of course, that businesses don't have the same level of control over employees at home as they do in the workplace. So think about, in the same way that you would manage any other risk, think about what the potential risks and hazards might be of employees working from home. Most commonly, it will be a workstation setup, which will present some level of risk. We don't have the same access to desks and ergonomic chairs, perhaps, and screens and so on, as we might do at work. So provide your employees with some guidance about how to set up their workstation in an ergonomic way. Remind employees about the importance of taking regular breaks, getting up, stretching your legs, eye strain. One of the things that's emerging, I think, after 4 or 5 weeks at home is that spending all day on Zoom meetings or MS meetings is also quite tiring. So just think about that, and think about trying to eliminate or minimize, or making sure that there's a variety of ways in which you communicate. Electrical equipment can present some risk, probably more likely slips, trips and falls from cords. So again, it's just about providing some guidance to staff members about how to operate safely. Electrocution, you're probably more likely to be electrocuted by your toaster than by your computer, so there's likely to be limited things that you can do. But obviously, if you're providing employees with laptops, you need to make sure that they are fit for purpose and safe to use. And also remember that for a number of your employees, they may be at home, isolated, or they may have the opposite problem of being in a crowded location with little privacy. So just again, think about what risks each individual employees might be dealing with, extra stress and workload, and it's a good time to remind employees about things like EAP, or provide information about steps that they can take from a wellness perspective. Again, getting outside, taking a bit of a walk, and other measures that may be available, and just cutting some people a little bit more slack at this time. So there is some helpful government guidance available on health and safety at home. As I said, it does need to be proportionate. You're not required to go and inspect employees' homes, and in any event, you haven't been able to under the lockdown. I've seen some health and safety at home plans with employees being required to tick whether they've got handrails on their stairs, for example. I don't think, my view is that is not something that it is falls within the responsibility of the employer to manage. But certainly things like workstation setup and dealing with issues relating to working from home, such as isolation or being around people all the time, attempting to homeschool children, so on and so forth, are matters that you can think about and provide some support to. So from here, we are moving on to the questions part of the session. And so, as Scott mentioned before, there is a little Q&A function for anybody who would like to ask any questions, and I'll come to those now. So I'll just a couple more slides to flick through before that. So short disclaimer from our insurers. So this is an overview. If you've got any specific questions or if you need any specific advice, please, of course, do contact us directly. And this is us. This is our Christchurch-based employment, health and safety team. You can see Scott and I there on the slide. Julia, Johnny, Raymond, Johnny, Georgie, and Hamish also part of the team here ready to help you. So I might need to put my glasses on to see if I can read these questions, otherwise it's not going to be much use. First question, one of the questions that have been asked, how often should health checks be done on arrival at work each day? So I think that I touched upon that during my part of the presentation in terms of the health check or checking in with employees that they are still safe and well. The current recommendation for WorkSafe is that should be done daily. Ideally, it should be done before employees arrive at work or at the latest on arrival. Employees should, of course, be clear that if there is any doubt, if they're feeling unwell in any way, they should be remaining at home. It's important to discuss with your employees in good faith what that means. Employees may particularly be concerned about whether they're going to be paid if they don't come to work, and so you need to be able to talk to your employees about that, and you do not want to encourage behaviours where people feel that they have to come to work even if they're a bit borderline in terms of health because they're worried about not having any income. So things like the COVID-19 leave payment, options to explore in that situation, as well as things like sick leave and special leave. But daily is the frequency. One question, my workplace is being used as a hub for CPRG. I'm actually not sure what that abbreviation means, and is a location for a CBAC triage. Is a roster a sufficient record, or should all workers still be signing in? My recommendation is a register is that where possible, people should be signing in and out, not just workers, but also visitors as well. That seems to be the guidance. A roster may be another way of doing it. If it records only the people who are at work, there would need to be a way of ensuring that a record is kept if anybody leaves site or isn't attending on that day, or if there are other people in the workplace on that day. I think the easiest way to do that is with a register, but there may be other ways. A next question, this is one's for you, Scott. Scott touched on working in multiple sites. Where contract commitments require staff to travel between regions for work, what implications are there for managing risk of transmission?
Yeah, look, under the alert level 3, where it's necessary to travel for work, that is permissible, but only to the extent that it's necessary. And it's a case of approaching it in a systematic way, assessing the risks and the individuals that and managing those risks. I don't see it being any different to if you're operating from one location and ensuring that you're keeping. I think that all the more important because you're coming into contact with others, a greater number of individuals that would otherwise be the case. So ensuring that you've got your controls in place, assessing those and making sure they're working and being comfortable that you are liaising with the businesses that you are coming into contact with in their presentation, and understanding how they're managing the situation, and if there's a concern that may impact on you how that's, or your business and your workers, how that's dealt with.
Thanks, Scott. Hopefully, we didn't have too many sound. I had a couple of sound issues, Scott, as you were answering that. But hopefully, we all got the gist of the response in terms of managing the risks. It's probably even more important to do so when travelling across multiple sites or different regions. A question: what defines a region in terms of how far our staff are allowed to travel for work-related activities? For example, is it okay to go rural to Timaru for work-related visit from Christchurch to conduct a field trial? So my understanding is that the regions are, for Canterbury, Otago, Westland, Southland, so on and so forth. So to answer that specific question, yes, it's okay to travel to Timaru from Christchurch to conduct work under Alert Level 3. The guidance is that businesses may travel to across regions, but to regions that are adjacent. So, for example, workplaces from Canterbury are permitted to work in Otago or Westland, for example, but can't go further than that. So wouldn't be able to perform work, travel to the North Island, for example, or down to Invercargill from Christchurch. Hopefully that answers your question, Ivan. I think those are, oh, no, sorry, we've just had a further question. And a couple of questions coming up. Sorry, while I pause just so I read them. So this is again about the frequency of health checks for workers on arrival at work each day. And this is quite specific around about the work being done. So if I give me a moment, I'll just read the question in full. It's a little bit long. So this is a question about employees who may have a health and safety issue, so carpal tunnel specifically. The question is, the basis of our work is very repetitive and we usually rotate people through different jobs and areas. With our COVID-19 plan, we are keeping work areas separate, so separate work bubbles, which is, my comment, a good and appropriate thing to do, as there are some employees who have a medical condition which means that they can't rotate through areas. Is it appropriate for them to suggest that they do not work as the business doesn't feel confident that they can manage the carpal tunnel's medical risk appropriately? So quite a long-winded question, but yeah, the answer is that yes, that's part of considering whether your COVID-19 health and safety management enables your employees to also work safely. You need to manage health and safety, existing health and safety risks in the normal way. They don't go away, so you shouldn't be requiring employees to carry out work that may be unsafe or cause them harm. Before asking them not to return to work at all, you probably want to think about other options whereby they may be able to return or do some work in a limited way. Again, the payment issue comes into play where there's a government subsidy available. Of course, that should be paid to the employees and the declaration complied with. That means that employees should be paid at least 80% of their normal wage, including if they're not working. There are, Scott touched upon before, the wealth of apps and technology available in different ways that you can keep track of your staff. It's particularly an issue where staff might be working remotely or alone. It is always important, but it's more important than ever now as a business that you are able to know where your employees are and satisfy yourselves that they are safe and well, both from a health and a safety perspective. So do look into, for example, things that are available like tracking apps, which if you don't have them in place already, might well be worth a look into as part of your ongoing health and safety management, but something that you particularly use to manage health and safety. Okay, so that concludes the questions that and the comments that we've received. Thank you very much for your contribution and participation. If you do have any other questions, if there's something that we haven't covered or something occurs to you at a later stage, do feel free to get in touch with us. As I said, our contact details are up there on the slide. We're all working from home but operating completely normally throughout these alert levels. So call us or email us. We'd love to hear from you. That's it for our presentation today. We want to thank you for your time and thank you for joining us today on behalf of Scott Wilson and I.